So now we'll move on to the deeper subcompartment of the posterior compartment of the leg. Now this is the smaller of the two subcompartments, and this one is bounded anteriorly by the interosseous membrane as well as the fibula and the tibia, and posteriorly it has the transverse intermuscular septum. Now, as we discussed before, this is a tightly confined subcompartment, and since the vessels and nerve also pass through this deeper compartment, it is more prone to having the compartment syndrome. And if a compartment syndrome occurs, it can lead to necrosis of these muscles as well as paralysis of the tibial nerve, which passes through this subcompartment here. Right, so the deep subcompartment contains four muscles, namely the plantaris, the tibialis posterior. Here you can see the tibialis posterior. This is the most anterior of these muscles. And then you also have the Flexor Digitorum longus and the Flexor Hallucis Longus muscle. Now, the Plantaris muscle is also a part of this deeper subcompartment, but you cannot see it here because the Popliteus is it is a small triangular muscle, and it is inserted into the upper part of the posterior surface of the tibia, just above the soleal line. So this is a cross section of the leg, just above the middle of the leg. So you can't see the Popliteus in this. So you can only see the remaining three, the tibialis posterior, the Flexor Digitorum longus, and the Flexor Hallucis Longus muscle. Now let's talk about the Popliteus first of all. The Popliteus is a small triangular muscle, the origin of which is from the lateral condyle of the femur, as well as the lateral meniscus, which would be here, of the knee joint, right? So this is where the Popliteus originates from, and then the belly of the muscle then exits the capsule of the knee joint, and then it is inserted here onto the posterior surface of the tibia, just above the soleal line. So you'll have the soleal line here, and just above that on the posterior surface, this is the insertion of the Popliteus muscle. It's a small triangular muscle, and it is present covered in a fascia, which is the investing fascia of the Popliteus. Right, so here you can see the Popliteus muscle. This triangular muscle is the Popliteus muscle. It originates from the lateral condyle of the femur as well as the lateral meniscus of the knee joint, and then it is inserted onto the posterior surface of the tibia above the soleal line. Now the Popliteus muscle has quite a few functions, quite a few actions that it brings about. The major or the most important function, of course, is that it is responsible for unlocking of the knee joint. So when your knee is fully extended, it is locked, right? And when you need to start flexing your knee joint, before the actual flexion can occur, you need the unlocking of the knee, right? And what that is that the Popliteus pushes, or rather pulls, the lateral condyle of the femur posteriorly, right? So it pulls on the lateral condyle and causing it to rotate laterally. So the lateral condyle of the femur rotates laterally and to about 5 degrees, and this results in unlocking of the knee. Once that 5-degree rotation has occurred, then the knee can start flexing, right? So once the knee is locked, it is fully extended and locked. So before it can actually start the flexion process, it needs to unlock, and the Popliteus muscle is responsible for the unlocking of the knee joint. Now this scenario, the unlocking of the knee, is this is when the lateral rotation of the femur on the tibia, this occurs when the foot is planted on the ground, right? But if the foot has been lifted off of the ground, now the femur is fixed and the tibia can move on the femur. So in this case, what the popliteus will do is that the femur will stay in a fixed position, and since the foot is off the ground, the tibia can move around, and this popliteus would then aid the semimembranosus and the semitendinosus in the medial rotation of the tibia. In addition to that, the popliteus is also responsible for very, very weak flexion of the knee joint. Plus, another action of the popliteus is that in the semi-flexed knee, it helps the posterior cruciate ligament in preventing the femur from sliding forward on the inclined tibial plane, the tibial articular surface, which would be inclined in a semi-flexed position. So the posterior cruciate ligament, in addition to the popliteus, prevent the sliding of the femur on the articular surface of the tibia. Deep to this popliteus muscle, there is the popliteal bursa, and it is supplied, the popliteus muscle is supplied by the tibial nerve. Okay, so next up we have the Flexor Hallucis Longus. Now, whenever the term hallucis comes up, it refers to the big toe, right? So Flexor Hallucis Longus would then mean that this muscle is responsible for the flexion of the big toe, right? And the origin of Flexor Hallucis Longus, as you can see here, is from the posterior surface of the fibula, the lower 2/3 of the posterior surface of the fibula here. And then it gets inserted into the base of the distal phalanx of the big toe, right? So this is the Flexor Hallucis Longus. Okay, now this figure shows the Flexor Hallucis Longus, right? As you can see, this is the soleus, the inverted U-shaped origin of the soleus that has been cut off. So underneath that, here you can see the deeper muscles, and this one here that has been slightly retracted from this part, this is the Flexor Hallucis Longus muscle, right? So this is the Flexor Hallucis Longus, and then the tendon of the Flexor Hallucis Longus muscle then passes underneath the flexor retinaculum. This is the flexor retinaculum. So the tendon passes here, and you can see it here. From here, it's going to travel all the way down to the base of the distal phalanx of the toe. Okay, so here you can clearly see the tendon of the Flexor Hallucis Longus muscle passing. So this is the sole of the foot, and the tendon of the Flexor Hallucis Longus passing all the way to the base of the distal phalanx. And when it passes here, it travels through these two sesamoid bones, right? And these two sesamoid bones are in the tendon of the Flexor Hallucis Brevis muscle. We'll talk about the Flexor Hallucis Brevis when we do the muscles of the sole of the foot. But for now, you need to know that the tendon of the Flexor Hallucis Longus muscle passes through these two sesamoid bones and then gets attached into the base of the distal phalanx of the big toe, sorry. Now the Flexor Hallucis Longus muscle is supplied by the tibial nerve, and its action is that the main action of the Flexor Hallucis Longus is that it brings about flexion at all the joints of the big toe. Since it is attached to the distal phalanx, it will bring about flexion at all the joints of the big toe. In addition to that, it also brings about a weak plantar flexion at the ankle joint, and along with that, it supports the medial longitudinal arch of the foot. We'll talk about the arches of the foot in detail when we actually do the foot, but a function of this Flexor Hallucis Longus is to maintain the medial longitudinal arch. So it is an arch on the medial side of the foot which is given support by the Flexor Hallucis Longus muscle. The next muscle is the Flexor Digitorum Longus muscle. Now the origin of the Flexor Digitorum Longus muscle is from the medial part of the posterior surface of the tibia, right? So this is the origin of the Flexor Digitorum Longus. Now the Flexor Digitorum Longus then splits into 4 tendons and gets inserted into the bases of the digital phalanges of the lateral 4 digits, right? So the lateral 4 digits, because the medial digit, which is the big toe, is supplied by the Flexor Hallucis Longus, and the lateral 4 digits are then the insertion of the tendons of the Flexor Digitorum would be into the Flexor Digitorum Longus muscle, would be into the distal phalanges of these lateral 4 digits here, right? So that is the Flexor Digitorum Longus muscle, and what it does is that it of course flexes the lateral 4 digits at all their joints, a weak plantar flexion, as well as maintaining the longitudinal arches of the foot. So here you can see the Flexor Digitorum Longus muscle, right? So this was the Flexor Hallucis Longus. This is the Flexor Digitorum Longus, right? And this is the tendon of the Flexor Digitorum Longus, and it passes underneath the Flexor retinaculum here, and then here you can see that it is splitting up into 4 tendons, right? And these 4 tendons would then get inserted into the lateral 4 digits, into the distal phalanges of the lateral 4 digits. So this diagram shows you the Flexor Digitorum Longus tendon in the sole of the foot, right? So here it is splitting into 4, and these 4 tendons are then traveling all the way to the distal phalanges of the lateral 4 digits and getting inserted into the bases of the distal phalanges of these 4 lateral digits. So the action of this Flexor Digitorum Longus is that it brings about flexion of the lateral 4 digits, as we just discussed. In addition to that, the plantar flexion, which is very weak, and maintenance of the longitudinal arches. It is supplied by the tibial nerve. So the fourth muscle in this deeper subcompartment of the posterior compartment of the leg is the Tibialis Posterior muscle. Now the Tibialis Posterior originates from the posterior surface of the tibia, the posterior surface of the fibula, as well as the interosseous membrane in between these 2 bones, right? So this whole thing is the origin of the Tibialis Posterior muscle. Now the Tibialis Posterior muscle then gets inserted into primarily into the navicular bone here. Now these are bones of the foot, the navicular, right? Then you have the cuneiforms here. So this is also, these are the cuneiforms. So it gets inserted into the cuneiforms and also into the second, third and fourth metatarsal bases of the second, third and fourth metatarsal bones, right? So all of these bones get the insertion of the Tibialis Posterior muscle. Now since the insertion is primarily towards the medial bones, the contraction of the Tibialis Posterior muscle brings about inversion of the foot, right? And so the inversion of the foot is when the sole of the foot faces the median plane, right? And the lateral margin of the foot is on the ground, and the medial margin of the foot is lifted off of the ground. That is the inversion of the foot, and it is brought about by the Tibialis Posterior muscle. It is supplied by the tibial nerve, and let me show you the muscle in a little bit more detail. Right, so here you can see the Tibialis Posterior. This is the Tibialis Posterior, and it is the deepest of all the muscles of this deep subcompartment, and it is attached to the tibia and the fibula, the posterior surfaces, as well as the interosseous membrane in the middle. So this one here is the Tibialis Posterior muscle, right? And then you can also see the Tibialis Posterior tendon here, right? So it's going to pass underneath this flexor retinaculum and then it's going to get inserted into the medial bones of the foot, like the navicular and the cuneiforms. Now here you can see the tendon of the tibialis posterior, right? And this is the tuberosity of navicular bone. So it is going to be inserted into the navicular bone. This is the cuneiform bone. It gets inserted into the cuneiform, and it also gets inserted into the bases of these. You can't actually see it being inserted because it is deep, but it is going to be inserted into the second, third, and fourth metatarsal, the bases of these metatarsals. So just an overview of the muscles that we've just done. The flexor hallucis longus brings about flexion of the big toe. So the flexion is the movement of the toes downwards, right? This is the direction of flexion, and this would be extension. So flexor hallucis longus brings about the big toe in this direction, and the flexor digitorum longus brings about the flexion of the lateral four digits this way, right? So this is flexion of the toes. And when we talked about the action of the tibialis posterior, we said that it brings about inversion of the foot. So the movement of the foot in this direction is inversion, when this is the big toe and this is the little toe, right? So if the sole faces this direction, this is inversion, and if the sole faces outwards, this would be eversion. Now, one of the conditions associated with the tendocalcaneus is calcaneal tendinitis. And calcaneal tendinitis, it refers to inflammation of the calcaneal tendon, and it usually occurs in one of the two conditions. Either a person takes up excessive activities after a prolonged period of inactivity. For someone who is not very active, if he starts working out excessively, it can lead to calcaneal tendinitis. In addition to that, it can also occur in people who are active, but they suddenly increase the intensity of their workouts. So that could also lead to calcaneal tendinitis, and this results in pain during walking and running. Now, another clinical condition associated with the tendocalcaneus is rupturing of the calcaneal tendon. It usually is seen in patients who give a history of the calcaneal tendinitis, right? And the history often contains an audible snap heard by these patients whenever they were walking and there was a forceful push, right? So during activity, in case of a forceful push, they heard a loud snap, which was followed by sudden pain in the calf, and the foot, which was plantar flexed, suddenly became dorsiflexed, because of course the tendocalcaneus is responsible, the triceps suri are responsible for the major plantar flexion at the ankle joint. So if there is a rupture, complete rupture of the tendocalcaneus, it is going to bring about a sudden dorsiflexion at the ankle joint. And if you actually palpate the calf, a lump can be felt in the calf where the tendon has been ruptured. Now this lump appears in the calf because of the shortening of the triceps suri. Now since they're not attached to the calcaneum anymore, they shorten and they appear in the form of a lump in the calf. Now when it comes to walking in these patients, the walking is only possible when they rotate their limbs laterally and try and walk without actually plantar flexing the foot. So there is a semicircular movement of the entire limb where they're not actually going to bring about plantar flexion, but then just rotate it to move it off of the ground and then put it back on the ground. In case of somebody who is active, who has an active lifestyle, this would then require a surgical manipulation, because otherwise this is a very debilitating injury, and walking would not be normal without actual surgical intervention.